So, Mr. Earp, I haven't seen you in a while. I was looking back to the notes. It looks like last time I saw you was March of last year, maybe a little more than a year ago.
Right.
Yeah, 12, 13 months. And at that point in time, I didn't recommend any additional surgery. I didn't think there was any surgery to be done.
Right.
And how are you back here? What's the process?
I had my own IME done,
Right.
and I showed him how I could release the nerve in my palm.
Okay.
I also showed Dr. Yaney Zenas. He's one of the lead orthopedic group in Denver. Him and his both his PA and himself believe this can be repaired. And I can show you real quick how easy it is to release this. It's all the way up to my neck, just like it's always been. This metacarpal bone, if you'll feel right there, there's a huge knot, sir. Feel that knot?
Like on me.
Okay.
Right there?
Yes.
Okay.
I get in between this with just my thumb. If I push hard enough, I can release the whole thing. Just with my thumb, sir. And I mean all the way up to my neck. All the way to my
So if he thinks it can be fixed, why didn't he fix it?
he doesn't take Medicaid. I can't go through his group. I'm in low income now.
But this was work comp.
I know this was a separate doctor. This is on a different deal. And he said he'd be glad to talk to you about it if you wanted to talk.
What's on a different deal?
She was being
There's my doctor,
her doctor. She was
my
being
appointment, and
examined. I showed him my injuries. He said, Lord.
What does he do?
He's the head of the orthopedic group in Denver, the leading orthopedic group in Denver.
This should not be under Medicaid if this is work
It's
comp.
not.
That's why he hasn't made no appointments, because he has to go.
I don't
through
think I can
worker
fix
comp.
it, honestly. It's more of a muscular release than any type of surgical release. And as I said before, I don't think I can do any surgery for it. If he thinks he can fix it, and you can get seen by him under
can't.
work, yes, you can. You can ask to be seen by him. It's work comp.
I understand that, but he
Oh.
won't take workman's comp. He's not
He'll
a
take-
workman's comp doctor.
They all are. Everybody takes work
Yeah.
comp.
He doesn't want it. He doesn't want anything to do with it. He told me so.
Well, I think it's a little
Workman's
unfair
comp.
for him to say he can fix it and then send you out of the office.
Well, how do I get workman's comp to pay for it?
You just tell him, I want a referral to this guy in Denver who says he can fix this. Because
Okay.
he should get paid. You actually get paid a little bit better for work comp than you do for anything else. But I don't think I can fix it. I wouldn't do any other surgery.
This ulnar nerve, it's just like it was. Sometimes it'll hurt my elbow so bad, it's ripping again. I know it is. And the ulnar nerve on this side of my elbow, it's big as a piece of rope. It's big as a pencil in my hand. It hurts all the time to my neck. Everything I've done.
But you were
doesn't help.
better after surgery.
Oh yeah, you got it out of my ear. Now it kind of just goes to my chest. It's locked onto my chest right here. And that's it. And whatever Lebowski did right here almost released this side. It still pulls a little right here and a little in the back, but not like it did. This pulls all the way up when I open my hand and try to use that right there. And you can see, I told Lebowski, this was his incision. I said, look, when I try to open my hand, it pulls directly on that incision. It needs to be neutralized until it's repaired. And I had to go through, you know what pain I went through.
Yeah. The question is, one of the first things you learn in med school is don't do any harm. Don't do stuff you don't think will help.
Right.
Or if you don't have, I don't think I have the skill set and the surgeries to
do this.
push you over the finish line. If he says he knows how to do it and it's an easy fix, and he told you
He
that,
said it was a release.
then he should
take
do
care.
it. If he thinks he can fix it, I don't think I can.
Something else I want to explain to you. When I came into your office for the first time,
Yes?
I didn't realize I had diverticulitis. I was so sick, I didn't know what I was doing. I had those medications I was trying to ingest. All right? I was portrayed as a drug addict, alcoholic, with COPD on my way out the door to die, I guess, according to this insurance company. And I know this was told to every doctor that I've been involved with. According to Dr. Tyler, this last doctor, he treated me like, he said, well, I guess you're not an alcoholic, your enzymes don't show it, but I don't know. You have a history of drug use, blah, 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 blah. Sir, I hadn't drank in 21 years. 21 years. I hadn't seen an illegal
What does that have
drug.
to do with anything about your arm?
I don't know.
Okay.
I don't understand it either. Why is it even in the report? That
It's not in
20
my, did you read my report? It's not in my report.
I hadn't read your late report.
No, the very first time I met you, August 19, 2013.
Well, see, when I did this last IME, I requested it myself, and when he started talking to me with all these drug and alcohol issues, 20-year-old issues, I thought, Lord, every doctor, that's why you wouldn't help me with my medication. Sir, with all my injuries, if you'll look at my MRI, sir,
I don't do chronic pain management.
I understand that, but I was portrayed as a hypochondriac, that I was faking my injuries for drugs, sir, and I
I don't
figured,
see that in anything I have.
well, I couldn't figure out why wouldn't you give me medication when I said I was having the wrong medication and I was in so much pain I was bawling, sir. I didn't understand that, and
Because I don't do chronic pain management. You need to see chronic. It's been going on a while. You need to see a specialist for that.
I did, and he
Okay.
just put me through hell. You know Castrione. He put me through. I did unnecessary stuff.
Okay.
Sir.
Okay.
Again,
Okay. Anyway, besides all that,
I don't.
I just want you to know I changed my life many, many years ago, and I worked my tail off. I lost everything I owned because of these injuries, to include tens of thousands of dollars in tools, because I could no longer perform my duties and pay for my tools anymore. And everything that I've lost, I won't ever get back. All my injuries that I have came from that workplace, and I want you to know that my shoulders, I ripped at this. I know it's not your part.
I can't solve any of this.
I understand.
The
I'm just
issue is
wanting
whether
you
or
to
not-
know you're the man that saved my life. Do you know that? I was literally going to die. You think I wasn't? I'd already had a heart attack.
I am appreciative of your.
You think I'm kidding?
No.
The thrill I had in the side of my head was so unbearable I couldn't even talk to people.
I'm happy I helped you. I don't. I think it's a little.
No, it's not. If I did,
It's a little overwrought to say I saved your life. I was
No.
happy I could help you.
If I'd have
The
gone
question
another
is-
3 months, I would have died.
The question is whether or not there's anything more I can do, and I don't think there is. I kind of done what I can.
okay.
If you have a guy in Denver who thinks that he can help you, then you get his name, get his number, get a referral to him through work comp.
I have referrals
I know, but you got to get a referral from work comp to him.
from work comp.
They're the ones paying for everything.
Oh.
So it's
Yeah.
not Medicaid, it's work comp at this point in time.
Yeah.
Well, do you know what's his name? The guy in Denver?
McCrae. Oh, you mean the
That's
doctor?
the lawyer, yeah.
Zennis.
How's that spelled?
Yanni Zennis. YANIZINIS.
YANIZINIS. Okay. And he's an orthopedist.
Orthopedic, the top
He's
in Denver.
my doctor.
Look him up online.
He did not see Randy, so don't be trying to
no,
get
no.
records or nothing. I'm getting that correct. Okay.
Yeah, no,
We
no.
had-
I would
He was
say
my
that
doctor. He
there was
took a little
there was
minute
curb-
to
there was
look at his
there was
hand.
a curbside, and Dr. Zennis says
Yeah.
there's something he can do.
Yes.
Okay. Well, good luck
It's
with
not on
everything.
written or
Thank
nothing.
It's not what? Okay. Nice seeing you both again.
Okay.
What was his
Thank you, sir.
Just so he can put it in his note that goes to everybody,
What's that?
that, the doctor's name.
Oh, yeah.
That-
Okay, that's fine.
Oh, Jesus.
And his PA is Heather. And she examined my...
So we're done now?
That needs a copy of this, and it gets a copy of it as soon as it's available in the next couple days.
Thank you.
Okay, you're welcome. Have a good day.
So he could tell me he couldn't fix it, just like I said. What do you mean?
I thought it was sticky. So we're done? No paperwork?
I don't know.
Did you have records you wanted?
Yeah.